Michael Swango. Murders committed by medical professionals often go unnoticed for a long time, especially when their patients are already sick or vulnerable. Michael Swango is a chilling example of that reality. After serving in the U.S. Marine Corps, Swango attended Southern Illinois University School of Medicine and later became a surgical intern at Ohio State University in the early 1980s. That's when colleagues began noticing something disturbing. An unusual number of his patients were dying. Despite the suspicions, proving murder in a medical setting is extremely difficult. Swango was investigated but ultimately cleared, though he was quietly blocked from continuing his surgical training. Instead, he found work as an emergency medical technician. That's when another pattern emerged. Co-workers noticed that whenever Swango offered them food or drinks, they mysteriously became violently ill. Eventually, investigators discovered he had been poisoning colleagues with arsenic and other substances. He was arrested and sentenced to 5 years in prison. After his release, Swango began a relationship with a nurse named Kristen Kinney. Soon after, she began suffering unexplained illnesses. Tragically, she later died, and evidence suggested Swango had poisoned her as well. Even then, he managed to return to medical work using falsified credentials, and the unexplained deaths continued. When authorities finally closed in, Swango fled the country, eventually ending up in Zimbabwe. But his past followed him. He was eventually captured, extradited, and sentenced to life in prison. The exact number of his victims is unknown, but estimates suggest as many as 60 people may have lost their lives.